Hi, I'm Izzy. I'm going to be your nurse today. How are you?
Good, how are you?
Good. Can you tell me your name and date of birth?
Autumn Cardenti, June 5th, 1997.
Great. So before I get started with the head-to-toe assessment, I'm just going to sanitize my hands. By doing this, I'm demonstrating proper infection control. I've removed all of my jewelry. I've cleaned my equipment. I've made sure that the room is free of issues that could interfere with safety. So I think we're ready to get started. Are you in any pain today?
No.
Okay. And I see you have glasses. Do you wear any other assistive devices?
No, just glasses.
Okay. So, can you tell me your name one more time?
Autumn.
Do you know where you are right now?
At my house.
And can you tell me who the president is?
Donald Trump.
Okay. So, the patient's oriented ×3. She's also alert. No level of consciousness has been lost. Her speech seems to be clear. She's articulating her words well. So, the beginning of her neuro assessment's looking good. Now, I'm just going to assess your gait. So, I'm going to have you stand up. And I'm going to have you walk to the window and back. Good. So there I'm not noticing any staggering or swaying. Her gait was fluid. There was arm motion. I'm going to give you 3 words that I want you to remember, and I'm going to ask you to recall them later in the assessment.
Okay.
This is going to test your short-term memory. The 3 words are going to be mirror, ball, and shoe.
Mirror, ball, and shoe.
You think you can remember those?
Mm-hmm.
Okay. So now I'm going to test your balance. So I'm going to have you close your eyes for me. Okay, open. So there I was seeing if you were going to sway or if there was going to be any movement, and there wasn't. So your balance seems to be good. Now I'm going to test your gross and fine motor function. So if you could take your fingers and match them up to your thumb to your fingers. And then your hands on your knees, I want you to flip. And then I want you to take your heel and match it to the opposite shin. Good. So the gross and fine motor function is intact. Now I'm going to have you close your eyes one more time. This is going to test your point localization and sensation. I'm going to touch a point on your body, and I want you to tell me where.
Okay.
Okay.
My left leg.
Yep.
My right arm.
Yes.
And the left side of my neck.
Great. So I think you can have a seat. So now I'm just going to assess your eyes. I'm going to assess your 6 fields of gaze. So if you could just follow my pen light for me. Good. So there I wasn't noting any nystagmus. Good. Follow my pen light in. And now I'm going to measure the pupils. Alright, so the pupils are running at about a 5, which is what we like to see. They're equal, they're round, they're reactive to light and accommodation, and like I said, there was no nystagmus. So the last thing for the neuro assessment, I'm just going to assess your cranial nerves in your face. Can you smile for me? And frown. Raise your eyebrows. And puff your cheeks. Alright, so the facial muscles are looking good. The cranial nerves seem to be intact. And before we move on, I'm just going to ask you to recall those 3 words I told you.
They were mirror, ball, and shoe.
Good. So her short-term memory is also intact. Now I'm going to move on to the skin assessment. Can you roll up your sleeves for me? So here I'm assessing all visible parts of the skin. I'm checking for any lesions, signs of infection, any ecchymosis, edema, redness, or swelling. I'm not noting any. The temperature of the skin seems to be warm. The skin's dry. It's pink. The pigmentation is consistent throughout. I would also normally check for the same things on the lower extremities, but because she's wearing pants, I'm just going to skip that for this video. I'm going to check your skin turgor. And that's almost immediate, so you seem to be hydrated. Looking at the nails, I'm not noting any signs of infection. They're not too thick or too thin. They're nice and smooth. Are they tender to the touch?
No.
Okay. I'm going to press down and assess cap refill. That's less than 3 seconds. So your circulation and perfusion seems to be doing well also. Now I would typically put on gloves before doing this, but I'm going to palpate the head. Here I'm making sure that the size is appropriate, that it's round, that there's no lumps or indentations. Looking through the hair for any signs of infestation or lesions, and I'm not noting any. That all seems to be looking good. I'm also going to palpate her maxillary and frontal sinuses, so can you let me know if you have any pain?
No.
Any pain?
Nope.
And what about here? Great. Now I'm looking at the trach. It seems to be midline. Do you have any problems swallowing or anything?
No.
Okay, I'm just going to palpate for your thyroid. Can you swallow? Okay, great. So that's all looking great. I think I'm going to assess your lymph nodes now. So again, let me know if you have any pain with that. Here in the preauricular?
Nope.
Postauricular?
No.
Submandibular?
No.
Cervical?
No.
And supraclavicular?
No pain.
Great. So now I'm going to move on to your eyes. I know you have glasses, but do you have any other problems with vision?
No.
None at all?
No.
Okay. So starting, the eyes are oval, they're symmetrical, they're placed appropriately in her face. I'm just going to flip these up for a moment. The sclera is nice and white, the conjunctiva is pink and moist, her pupils and iris are round. Color's brown, it seems to be pigmented evenly throughout. Again, no problems with vision. No redness or drainage coming out, so those are looking healthy. The eyelashes and eyebrows are also nice and evenly distributed. So now I'm going to move on to ears. Do you have any difficulty hearing at all?
No.
Okay, they seem to appear even on both sides. They're in line with each other, placed appropriately. I'm not noticing any signs of skin cancer or lesion on those. Do you have any pain when I palpate like this?
No.
And what about here on the tragus?
No.
Okay, I'm noting that you have 3 piercings on each side. Have you had problems with infection?
No.
Okay, great. Now I'm going to perform a little test called the whisper test, and I just want you to repeat the words back that I say.
School. Nurse.
All right, so the words I said were school and nurse, so her hearing seems to be intact. And lastly, I'm just going to check for drainage in there. And I'm not noting any. So I think your ears are looking nice and healthy as well. So now I'm going to move on to your nose. That is also centered in your face. It seems to be even. Your nostrils are even. Do you have any problems with your smelling?
No.
No? I'm not seeing any drainage in the nose either. I'm just going to test the patency of your nares.
Okay.
So if you could press against and blow on each side. All right, so the nares are patent bilaterally, so that is good. Moving on to the mouth, do you have any problems with taste?
No.
And I already clarified earlier, no problems with swallowing.
No.
Okay, I'm just going to have you say ah for me. Ah. So looking in the mouth, it's nice and pink. The mucous membranes are moist. The teeth are in good dentition. The tongue is nice and even. I see the tonsils, no signs of inflammation, making a nice M shape. The uvula is midline. The palate rised bilaterally. So I think that's looking good. The lips have no signs of lesions or infection there either, so that all looks pretty healthy. So now I'm going to move on to your respiratory assessment.
Okay.
I'm going to listen to your lung sounds anteriorly and posteriorly. So if you get out of breath at any point in time, just let me know.
Okay.
However, throughout the assessment I have been watching, your chest seems to rise and fall bilaterally, which is nice and healthy. Your chest is cone-shaped, no signs of barrel chest, which is what we like to see. Your respiratory rate is also within normal limits. Do you think you ever have any problems with breathing or shortness of breath?
No.
Okay. Could you stand up for me? Before I listen, I'm just going to test the expansion of your lungs. So could you take a big breath? Perfect. So there, when she took her breath, my thumbs moved apart about an inch, which means that the chest is expanding well. So now I'm just going to take a quick listen. Deep breath in and out. Great. And can I listen to the back? Deep breath in and out. And again. And now I'm going to listen to the right middle lobe. All right, perfect. So there, all lobes seem to be clear. I didn't notice any wheezing, crackles, stridor, nothing like that. So I think your lungs are also healthy. I'm now going to move on to your cardiac assessment. I already did assess this during her skin, but all extremities are warm. I'm not noting any cyanosis, so I think oxygenation and perfusion is pretty good. Do you have any problems with that?
No.
Okay. So before I listen to the heart, I'm just going to start by palpating. Here, I'm not noticing any heaves or masses. I'm not feeling any thrills on the chest. So now I'm also going to listen to the heart. I'm going to listen to 5 spots, ape to man, and I'm going to use the diaphragm and bell of my stethoscope. Great. And now I'm just going to feel for all of your pulses as well. When I was listening to the heart sounds, the rhythm and regularity was great. I didn't hear any signs of a murmur. So here I'm just going to feel the carotid pulses. Good. The radials. The dorsal pedis. And the posterior tibialis. All pulses were present. They feel at about a +2, which is nice and normal. And now I'm just going to take a listen to your carotids and make sure there's no bruits. All right, and I didn't hear any bruits there. So I'm now going to move on to your abdominal assessment. So if you could lay down on the couch for me. Would you pull up your shirt a little? So here I'm looking for any signs of distension or ascites, and I'm not seeing any. Do you have any stomach pain?
No.
Okay, so I'm just going to take a listen to your bowel sounds. I'm going to start in the right lower quadrant and move clockwise. And there were bowel sounds present in all 4 quadrants. And while I'm here with my stethoscope, I'm also going to listen to your artery sounds. I'm going to listen to your aortic, your renal, and your iliac. All right, great. No bruits were auscultated there, so that is good. And again, you said you didn't have any pain on your stomach? Okay, so I'm just going to palpate around. If you have any pain, just let me know. No pain while doing this?
No.
Great. All right. So your stomach seems to be pretty healthy. Do you have any problems with BMs or anything?
No.
Okay, great. If you could just sit up for me. Actually, could you stand?
Sure.
Now I'm going to assess your musculoskeletal system.
Okay.
So first I'm going to have you dive over so I can take a look at your spine. Great. Your spine is right centered. I don't notice any deviations or curvature. You could stand back up. Go ahead and take a seat for me. So first I'm going to start by assessing range of motion and strength in your upper extremities.
Okay.
First I'm going to have you open your mouth as wide as you can. Good. I didn't feel any crepitus there. That was a test for TMJ. Now I'm just going to have you roll your shoulders around for me. Good. Bend your elbows. Roll around your wrists. And move your fingers. Great. I didn't notice any crepitus in any of those joints. I'm now going to test the strength of them as well. Could you shrug your shoulders against the resistance? Good. And stick your arms straight out. Could you push up? Push down. And again with your hands. And then grab my hands. Good. So our strength is equal bilaterally, seems to be strong everywhere. I'm now going to test the range of motion and strength in your lower extremities as well. So could you push against and pull and push up on my hands and step on the pedal? Good. And then I'm going to have you swing your legs over so I can test range of motion. Could you lift your leg up and down and swing it out? Bend your knee, roll your ankle, and bend your toes. Same thing on this leg. Lift it up, swing it out, bend your knee, roll your ankles, and wiggle your toes. Good. I didn't notice any crepitus there as well. Do you have any questions or concerns for me?
No.
Okay, so I think that completes the assessment today. Thank you.
Thank you.